Today we are seeing anemia. Anemia means overall we can say that anemia means less blood, isn't it? Actually, the total number of RBCs or hemoglobin concentration in the blood is below the normal limit, Actually, anemia means what? Having, in layman language, we tell as having a less blood. But actually, it is decrease in total number of red blood cells or hemoglobin concentration in the blood below the lower limit of the normal range, below the lower limit of the normal range. Now see here. In adult, the lower extreme of normal hemoglobin is taken as 13 gram per dl per deciliter for males and 11.5 gram per dl for females. Actually, how much it is? Normally, we seen in the HFE. That is the normal hemoglobin count in the male, that is the 16 to 18, isn't it? Actually, up to 13, but below normal hemoglobin is taken for the male, that is below 13 gram per dl, and in female it is 11.5 gram per dl for females. Okay, and the newborn infants have higher hemoglobin level, therefore 15 gram per dl taken as a lower limit at birth, whereas 3 months in normal lower level is 9.5 gram per dl. 3-month baby, it is considered as 9.5, and for the newborn infants 15 gram per dl taken as a lower limit. Actually, for the children's or the infants, how much it is? 20, 16 to 20 or 18 to 20, isn't it? But the lower to lower limit, that is we consider as a 15 gram, that is the limited, the level, the higher hemoglobin level. Actually, the newborns are having more hemoglobin, isn't it? Actually, the normal range is how much? How much? That is 16 to 20 gram per dl. But here anemia for the newborn, we considered as below 15 gram per dl. We considered the limit, that is the 15 gram per dl. Are you getting? And for the male, actually it is 16 to 18. And for the female, 12 to 14 or 15, isn't it? But here the lower to lower limit we considering. That's why when the anemia is caused below the lower to lower limit of the normal range. So that for the male, it is we considered as 13 gram per dl, and for the females, we considered as 11.5 gram per dl. Okay, now see the classification. Pathophysiological classification and morphological classification, both we are studying here today. Pathological and morphological classification. First, we will going to see the pathological classification. Again, it is subdivided, that is anemia due to blood loss. Anemia due to blood loss. Now, here also again two, acute and chronic. Acute and chronic. That is acute post-hemorrhagic anemia and anemia due to chronic blood loss. Anemia due to blood loss. That is the one classification here. Acute post-hemorrhagic anemia. Acute within the few days. And here chronic blood loss. Anemia due to chronic blood loss. Okay. And in detail we will see afterwards. Anemia due to impaired red cell formation. That is immature RBC formation. Again subdivided into, that is cytoplasmic maturation defect. Cytoplasmic maturation defects, again classified into two, that is due to deficient heme synthesis. Example, iron deficiency anemia. And second one, that is the deficient globin synthesis, that is thalasmic syndromes. That is thalasmic syndrome. Hemoglobin, it is made up of heme plus globin, isn't it? If there is deficiency of heme synthesis, iron deficiency anemia. If there is deficiency of globin synthesis, then thalasmic syndromes. Okay. Now next one, nuclear maturation defects. Nuclear maturation defects, that is here vitamin B12 and folic acid deficiency. Vitamin B12 and folic acid deficiency, that is megaloblastic anemia. Example, megaloblastic anemia. In detail, all the anemias we will see in detail, but here in short, we are seeing this one classification. Now third one, that is the hemopoietic stem cell proliferation and differentiation abnormality. Under this, aphasic anemia and pure red cell aplasia. Okay. And next one, that is the bone marrow failure. Actually, all the stem cells are produced in the bone marrows only. If the bone marrow only fails, then it, due to systemic diseases, some of the diseases, if it fails, it produces anemic condition. That is anemia due to chronic disorders. Chronic disorders. If the patient, if the individual is suffering from the disease, chronic disease, then it leads to anemia. Various in, again subdivided, that is anemia of inflammation or infection. Various type of inflammation or various type of infection. Yesterday also we seen, that is the tuberculosis, isn't it? That is one of the infection. Okay. So anemia of inflammation or infection. Anemia in renal diseases, acute or chronic. Okay. Anemia in the liver diseases. Means what? Here the anemia is caused due to the liver diseases. Chronic liver diseases. Okay. Anemia due to endocrine and nutritional deficiencies. Nutritional deficiency. Chronic nutritional deficiency automatically leads to what? Anemia. So these are the subtypes. Okay. Bone marrow failure. Due to what? The bone marrow going to fail due to what? Due to the sum of the diseases. So many diseases are there, but that is due to chronic disorders. If acute, the bone marrow will not get failure. Okay. If it is chronic, then and then only it will get fails. Okay. Bone marrow infiltration. Now here also leukemia, lymphomas, myelosclerosis, multiple myeloma, so many. That is due to bone marrow infiltration. Next type, that is a congenital anemia by birth only. That is the sideroblastic anemia. The RBCs are not mature here. Congenital dyserythropoietic anemia. That is the RBCs are, the synthesis or the production of anemia is not proper. That is the congenital dyserythropoietic dyserythropoietic anemia. Okay, erythro that is RBCs. Okay, dyserythropoietic anemia. Now next one, that is the third one, that is anemia due to increased red cell destructions. The RBCs will get destructed due to what? Hemolytic anemia. It is called as a hemolytic. Lytic means breakdown. Which breakdown? Hemoglobin breakdown. Okay. Again divided into two. That is the intracorpuscular defects, and next one, that second one, that is the extracorpuscular defects. Intracorpuscular defects, hereditary and acquired, both. Extracorpuscular corpuscular cells defects, acquired hemolytic anemias. Acquired hemolytic anemias. Now fourth one, morphological classification. Now next one, that is the B1. Actually it is not fourth one. Actually we are going to see that is the pathological classification and morphological classification, isn't it? So next one, that is the, here we will consider it is here, it is the B. Okay, that is the next class, that is the B1. Okay. Morphological according to the morphology, that is the size, isn't it? Based on the red cell size, hemoglobin content, red cell indices, how much it is, the concentration. Okay. So microcytic hypochromic anemia, micro, the name itself indicates less blood cells, okay? Or the RBCs are having small size, reduced size. That is the microcytic hypochromic, HB contents are less, okay? This is due to the, which it is based on the RBC size, HB content and red cells. That is, we always in the laboratory investigation, it is come under this one, MCV, MCH, how much it is, that one, the normal count, isn't it? Normocytic, normochromic. Okay, two are there, microcytic, hypochromic and normocytic, normochromic. Okay, after the acute, with this condition, it microcytic or hypochromic, this condition, example, iron deficiency anemia. Due to less iron, the RBC size will also less. Here, that is the RBC, the hemoglobin content is less, isn't it? And here in the normocytic, normochromic, after the acute blood loss, everything is okay, but after a acute blood loss, hemolytic anemias, examples, hemolytic anemias, bone marrow failure, we see now above that one. Anemias of chronic disorders, isn't it? This is due to this one. All the size and this one is normal, but the contents are less. Due to what? Due to what? The acute blood loss, hemolytic anemias, bone marrow failure, anemias of chronic disorders. This is all about the classification. First one, pathological classification. Next one, morphological classification. Pathological, we see this one, anemia due to blood loss, anemia due to impaired RBC formation. Okay, again it is subdivided into this one. That is the cytoplasmic maturation defects, nuclear maturation defects, okay, hemopoietic stem cell proliferation and differentiation abnormality, bone marrow failure, bone marrow infiltration, congenital anemia, anemia due to increased red cell destruction, okay, and last one, that is the morphological classification. Okay, now see the signs and symptoms, that is the clinical features of the anemia. That is speed of onset of the anemia, how much it is. Severity of the anemia, how much it is severity. It is below 6 or below 8, then it is considered as a severity. Age of the patient, what is the age of the patient? According to that one also it is considered, that is signs and symptoms. What we called as the disease, how much we are taking, that is depends upon the age. If the patient is, the individual is too old, then there is no chances of any development of the RBC. So they have to give the externally the blood supply of the blood. So it depends on age of the patient. Hemoglobin dissociation curve, that is also very important. We will see. Clinical features we are seeing here: speed of onset of anemia, severity of the anemia. Also consider here the age of the patient and hemoglobin dissociation curve. If we will plot the graph, then we have to see that is the main thing. Now see here the etiology. Various causes are there. Genetic etiology. Again it is hemoglobin pathies, thalassemias, enzyme abnormalities, defects of RBC cytoskeleton, hereditary gerocytosis, Fanconi anemia. Means here etiologies are here described: genetic etiology, nutritional etiology, physical etiology, chronic disease and malignant etiologies, infectious etiologies. These are all the causes. In the genetic, by birth only, okay, some of the deficiency is there. That's why here genetic etiology. Nutritional: iron deficiency, vitamin B12 deficiency, folate deficiency, starvation, generalized malnutrition, isn't it? Physical etiologies, that is trauma, burn, frostbite, isn't it? These are the physical etiologies. Sudden loss of the blood, isn't it? Chronic diseases, due to the renal diseases, chronic infection, neoplasia, that is the cancer, collagen vascular diseases, due to the chronic disease, and malignant etiology, that is the cancer. Infectious etiology, so many are there: viral hepatitis, bacterial, protozoan, isn't it? These are of the infectious etiologies. So these are the types of the etiology: genetic, nutritional, physical etiology, chronic disease and malignant etiologies, infectious etiologies. Okay. Now see the signs. How the patient, by seeing the patient, we can say that means doctor can say that it is anemic. How it is looking like? Pallor. It is seen in the mucous membrane of the skin, conjunctiva. Usually the doctor, after going there, they see our eyes conjunctiva, isn't it? So if it is reddish, then it is healthy, having good hemoglobin. By seeing the skin also, if no hemoglobin, then that is the little bit pale, isn't it? We can say that is a little paler. Mucous membrane, skin, by seeing the mucous membrane, if it is whitish too much, then we say that having less hemoglobin. Okay, conjunctiva, only whitish, then or less pink, then we can say that hemoglobin is less, means the patient is, the individual is anemic. Cardiovascular system. The hyperdynamic circulation may be present with the tachycardia, collapsing impulse, and congestive cardiac heart failure. CVS system also included here. Due to that one, how tachycardia, more heart rate, increase in the heart rate, collapsing the impulses, not we can respond that one, the impulse, if you will see. Okay, CNS. What is there in the CNS? How we can guess? Faintness, giddiness, headache, tingling sensation. These are all related to this the anemic condition, but these are the CNS symptoms. Which are those one? That is the faintness. Means what? Attack of faintness means giddiness. That is the giddiness. Headache, always headache. Okay. The tingling sensation. tingling sensation, how we can say that? Okay, tingling sensation of the hands and the feet. Okay, ocular manifestations, radial hemorrhages may occur here. Okay, retinal hemorrhages may occur. Reproductive system, that is the menstrual disturbances such as amenorrhea and menorrhagia, and loss of libido occur in the reproductive system. Renal system, mild proteinuria and impaired concentrating capacity. Okay, impaired concentrating capacity of the kidney may occur in anemia. Are you getting this one? Gastrointestinal system, nausea, sometimes vomiting sensation, flatulence, means gases, constipation, weight loss may occur. This is overall this related to which system? Gastrointestinal system. These are all the signs. Pallor, CVS system, CNS. In the CVS system, what we see? Congestive heart failure, collapsing impulse, okay, tachycardia. CNS system, what we central nervous system, what we see under this one? The faintness, that is the giddiness, headache, tingling sensation. Ocular manifestation, actually here we see retinal hemorrhages may occur. Okay, reproductive system, renal system, okay, and GI. Now see the symptoms. What are those symptoms? Muscular weakness. Obviously, no blood, no RBCs, no hemoglobin. Then muscular weakness is there. Okay, though the RBCs are there, but less content of the hemoglobin, then less oxygen carrying capacity, so no supply of the oxygen. So there is a weakness or lethargy. Lethargy, headache, fatigue, nausea, irregular heartbeats, congestive problems, that is the congestive heart failure, retinal hemorrhages, whatever we seen here in this one, that is the signs, that are the symptoms. Okay, signs and symptoms, that is overall muscular weakness or overall weakness, lethargy, headache, fatigue, nausea, irregular heartbeat. This one, retinal hemorrhages, congestive heart problem. Now how to prevent this one? Iron deficiency and vitamin deficiency anemia can be prevented by choosing a diet. If our diet is healthy, then having no iron deficiency and vitamin deficiency, isn't it? For this one, variety of vitamins and nutrients we can include, that is the iron, green leafy vegetables. Always eat green leafy vegetables, it contains the iron. Dried fruits, okay, dry fruits, that is folate, the citrus food and juices. Which one this one? Sweet lemon, isn't it? Oranges, all the citrus fruits contains the folate. Vitamin B12, where we can find meat, dairy products, okay. Vitamin C, again it is coming to the citrus fruit, melons, berries, isn't it? So if our diet is healthy, no any problem of these type of deficiency. How we can diagnose? Physical examination and CBC count, that is the complete blood count. Here all numbers we can check, the RBCs, WBCs, platelets, or we can see here. Okay, physical examination, what the doctor will check here of that individual? The possible cause of the anemia during the physical examination, doctor may listen to the heart and breathing sound. If more problem is there, if anemia is little bit more, then by seeing the heart sound and breathing sound, the doctor can understand. By seeing the conjunctiva, by seeing the skin, by seeing the patient, isn't it? These are all the signs and symptoms. All these are seen by this in the diagnosis. Physical examination, by seeing the physical, by asking the medical history, isn't it? overall the doctor can say that the patient is anemic. Okay. And the laboratory test, what they will see, what they will check here, the CBC count. Okay. Treatment, what type of treatment here? Dietary supplement is, if we will increase, that is the supplements. So dietary changes in the supplements, low levels of the vitamins or iron in the body can cause certain types of the anemia. So give that one, isn't it? Increase the diet of iron, increase the diet of citrus food so that we can get the vitamins, isn't it? Vitamin B12, vitamin C, isn't it? All we can get here, isn't it? So folic acid, vitamin C, everything we will get here. Okay, so that we can fulfill the deficiency of all these vitamins and this one proteins and everything. Okay, all these deficiency. Okay, now see here the medicines. Which type of medicine? If infection is there, control that infection by giving the antibiotics, isn't it? Hormones to treat the menstrual bleeding in the adult woman. If there is any problem, then give that one. Okay. Erythropoietin stimulate the body to make more blood RBCs. Okay, erythropoietin system, that is, we have to here stimulate the erythropoietin system. Means what? Poiesis means what? Synthesis. Erythropoietin means what? RBC synthesis. The development of the RBCs we have to stimulate if they are less in number, so that there will be more RBCs. Medicine to prevent the body's immune system for destroying its own red blood cells. Sometimes some of the bodies, our own system only disturbs. They destroy our own RBCs only. So give that type of the medicine to prevent the body's immune system, isn't it? Chelation therapy for lead poisoning. If there is any lead poisoning is there, then give chelation therapy. Okay. Then this will forms a complex and produces and destroy and then leaves out from our body the lead. Okay, due to the complexation, that is the due to the chelation. Then supplements, which type of supplements? Iron salts, ferrous sulfate, okay, and other vitamins, vitamin B12, folate, vitamin C, okay. Blood transfusion. Lastly, that is the blood transfusion. If the old age is there, if it is not responding the body, then directly we have to give here the blood transfusion. In the severe accidental blood loss, that time also there is no any provision, but we have to give here the blood transfusion only. This is the only method for that. Okay, in the severe cases, safe procedure to give through the IV. We have to give the blood IV only. Okay, blood and bone marrow stem cell transplant. Okay, if the stem cells are not work this one, then we have to give the blood and marrow, bone marrow stem cell transplantation. We have to transplant the stem cells in the marrow, that is the bone marrow, blood and bone marrow transplantation. Okay, surgery. If there is, why we have to need that surgery? To control ongoing bleeding due to colon cancer. If there is cancer, if there is tremendous loss of blood, means bleeding condition is there, that time if we are not stop that bleeding, then we have to give them, there is a need of surgery. This is all about the treatment. Dietary changes in the supplements, medicines, other supplements, it comes under this only. Okay, blood transfusion and the bone marrow stem cell transplant, surgery, last one. This is all about the, in short, that is the introduction of the anemia. In short, that is the intro of that anemia. In detail, we will going to see in the next lecture. What we see in this overall, what we see here in this one, anemia means what? What are the normal ranges? Classification, their signs and symptoms, diagnosis, the prevention, treatment, everything, etiology we see here. But single anemic disease, that is the iron deficiency anemia, sickle cell anemia, megaloblastic anemia, like this in detail, single anemia, we will see in the next lecture. Okay, understood this one?